Yes, I hear that question quite often. And actually, it begins much earlier in their younger days. You know, what men are experiencing in their 40s, 50s, and 60s is usually a culmination of choices they've made early on in their 30s. The traditional standard American diet, our hectic lifestyle, our endocrine disrupting chemicals, the pollutions, pesticides, everything that we're exposed to, and what we do to ourselves with processed food and seed oils, lack of fitness, lack of training. And what happens over time is all of this leads to preventable underlying conditions that men are often plagued with and challenged with. For example, I speak to dozens of men every single day, and I can tell just by looking at their photographs or listening to their histories that they're plagued with insulin resistance or chronic low-grade inflammation. They're suffering from excess body fat or even visceral fat or skinny fat. And what this does over time is it wreaks havoc on the body. It wreaks havoc on the mitochondria, which are the ATP powerhouse cells of the body, where your body generates energy and produces hormones. It creates low-grade inflammation that gum up the cells, block the androgen receptors where hormone signaling occurs. And then, of course, you have excess body fat that aromatizes testosterone, turns it into estrogen. And this culmination, this cumulative effect is really just the bill coming due from years of neglect. Well, the biggest mistake is men wait. They wait for the wheels to come off the bus. And then when the symptoms start to arise, they go, oh no, something has hit the fan. And as a result, they end up just starting to chase symptoms. And those symptoms are low energy, brain fog, low libido, poor performance, expanding waistlines, bulging medicine cabinets, the list goes on and on. And instead of going back and addressing root cause issues, they're actually masking and trying to cover up symptoms. It's like cleaning your home and sweeping, your floor and then putting the dirt underneath the carpet so you don't see it. And the problem with that methodology is that men's health, the disease process started years ago. That train left the station long ago. And what they're trying to now do is try to slow the momentum of this train that has left the station by reacting, taking a defensive approach to the health versus taking an offensive approach to their health. Yeah, the problem with that is that definition's too vague. People say, well, I eat well. Well, I watch what I eat. Oh, I go to the gym. Well, what exactly does that mean? See, I speak to dozens of guys every week that think they're doing the right things, but they're actually doing things that are actually harming them. Not to mention, I'm at the gym quite frequently. It's part of my lifestyle. It's part of how I have prevented the aging process. It's part of how I've optimized my health and well-being naturally. And I watch men work out all the time. And half the time, honestly, I want to go tap some of these guys on the shoulder and say, you know what, nice effort, good for you being here, but you might as well just go home. Because they're spinning their wheels. They're not doing the right reps. They're not doing the right weight. They're training out of ego. They're not doing the right form. And the same thing comes down to diet. They think they're eating the right things, but they're still eating plant defense chemicals that are loaded with oxalates that can interfere with thyroid function, which can interfere with testosterone production. They're eating oatmeal that's loaded with phytic acid, for example, that'll rob the body of zinc, which is a key mineral in the testosterone synthesis process. So men are thinking they're doing the right things, and then the biggest mistake that they're making is that they're outsourcing their health to Google. They think they can figure this out on their own. So they do this kind of patchwork repair on their body and their health, trying to figure this all out on their own, and as a result, they end up just spinning their wheels. Really, it's just getting down to the basics. And that's the whole purpose of my practice. Rather than focusing downstream, meaning symptom-based, pathological-based, we focus on root causes. What are the physical, chemical, and emotional stressors that started this downward spiral or this downward cascade in health today? It means men need to start getting proactive with their health. They need to start looking at their lab analysis. The amount of men that I speak to that have no clue what their labs are, what their internal biomarkers are, is truly eye-opening, I'll say it that way. When we need to know what's going on inside, what is that compass pointing us to? Where is that leading us? And so much of what men are being plagued with in their 40s and 50s and 60s is preventable. It's reversible through lifestyle modification. So you got to get away from the fads, got to get away from the gimmicks and the so-called quick fixes. You can't out-medicate, you can't out-supplement, you can't out-work out a bad diet and a bad lifestyle. So we start there first. get back to the fundamentals, master those, and then we start adding on ancillary therapies, supplements, training, and fitness. Yeah, so estrogen is not the villain. We need estrogen as men. It's important for joint lubrication, it's important for brain function, it's important for bone health. The problem is when estrogen in relation to testosterone gets out of balance and estrogen starts to become more dominant. And so when that ratio starts to skew in the wrong direction, estrogen starts to interfere with multiple different pathways. It starts blocking androgen receptors from testosterone, being able to dock and put its signaling into place. It can create neuroinflammation in the brain, which can lead to brain fog. Estrogen increases insulin resistance, which causes the body to store more fat. It increases fat cell size. It increases water retention as well. That can lead to that water weight gain or that gynecomastia or man boobs that are often plagued with as well. And so it's when it becomes skewed and out of balance where estrogen becomes the problem. And it's one of the most overlooked causes behind why men feel the way that they do. It sounds simple, right? Just take some more testosterone. You're low on T, so take more T. Here's the thing. I speak to dozens of guys every single week that are on testosterone therapy that feel absolutely no change whatsoever. I've got guys in the 400 to 500 nanograms per deciliter range that feel like rock stars, and their wives can't keep up, if you know what I mean. But I've got guys that are artificially manipulated that are 1,300 nanograms per deciliter, and they still feel like crap. The question is how is it being utilized? It's not just total testosterone. It's what's free and what's bioavailable. Well, what interferes with that? Number one, sex hormone binding globulin, okay, which is a protein that's like Velcro. It gobbles up your testosterone, so it's not free and available for use. And then excessive aromatization, where your testosterone is being converted into estrogen. And this occurs because of insulin resistance, inflammation, and excess body fat. And so many times guys are chasing these symptoms. They're inflamed, they've got insulin resistance, they've got excess body fat or excess visceral fat, skinny fat, and that testosterone that they're artificially injecting into their system just gets converted into estrogen. And then a lot of these men will then end up on an aromatase inhibitor, for example, an anastrozole, okay, to help prevent that conversion process. And then that's where the upward spirals of more medication starts to occur. So it's not just total testosterone, but it's also what's free and bioavailable. And I always tell my guys, are you really wanting higher amounts of T? Or do you just want to look good, feel good, perform well from the fitness room to the boardroom and to the bedroom and everywhere in between? And that's at the end of the day what men are after. Yeah, well, they confuse it because they think more is better, right? So it goes back to the original points that I was making of looking at what's free versus what's bound. SHBG and excessive aromatase activity. When you have too much SHBG activity, you don't have enough that's available to help yield the benefits that testosterone provides, or both are occurring where too much is actually aromatized and converted into estrogen. Yeah, I mean, it's such a common thing today, but just because it's common doesn't make it normal. And let's break this down a little bit. Let's look at the modern American lifestyle and what is being taught to being a man today. And here's what I mean. You know, the dad bod is glorified. You've got beer commercials telling you what it means to be a man, what it means to have fun, right? That now almost that beer belly is a badge of honor, where inside I'm watching these commercials going, you know what? I could actually make the argument that that's actually making you more of a woman than it is a man. And here's why. Because that lifestyle leads to insulin resistance, low-grade inflammation, excess body fat. It aromatizes your testosterone, turns it into estrogen. Here's the other thing about alcohol. Alcohol actually aromatizes your testosterone into estrogen. Alcohol affects the liver. Liver is primary in detoxification of estrogen down into its metabolites so it can actually be excreted. If the liver is not functioning properly due to chronic alcohol use, then what happens? That estrogen then just gets recycled back in the body, and that's how estrogens can start to elevate. You combine that with processed food, too much sugar, elevated seed oils, and then you create a perfect recipe for a man feeling the way that they do. Yeah, there is a time and place for TRT. And in my practice, I actually have medical providers that I work with. But what we find in my practice, and the men that I work with, because we're not working downstream, we're working upstream. What's causing the issues in the first place? We find that upwards of 80% of men will actually never need TRT. And even if you do take TRT, the question that I always ask my clients is, well, what caused it to tank in the first place? See, our body can produce enough testosterone well into our golden years. It's not inevitable decline as we age. What has been accepted, or what men have been taught, that it is normal decline. What I'm making the argument is that our lifestyle is not normal for what men actually need to perform the way that a man wants to perform today. And as a result of ignoring these underlying causes, even if a man is on TRT, as I've explained before, doesn't necessarily fix the root cause issue: insulin resistance, inflammation, excessive aromatization into estrogen. And I've got men every single day that are on testosterone that absolutely feel no change whatsoever. Yeah, I can say all this because as a man, I've been there. Today's man, it's a badge of honor to sacrifice our health and fitness for career, family, and success. It's what we're taught. And we're taught that at the expense of our health. And so I used to be that guy that didn't exercise regularly, who was drinking beer on the golf course, having hot dogs, having a good time with the guys, enjoying my beer and wings. And as a result of that, I was 30 pounds heavier in my 30s than I am today, 55. And, everything tanked along with it. And the worst part about all of it, it was early on in my years and starting my practice. And here I was, a physician, trying to look patients in the eye and say, you know what, you need to eat better, you need to train better. When inside, I wasn't doing that myself. And it's my biggest pet peeve today, are doctors that don't practice what they've been taught. I don't know how you can look a patient in the eye. And so, I had the low energy, I had the brain fog, had the low libido, I wasn't seeing the results in the gym, I wasn't feeling like the man, I was starting a young family. And I knew that there was a better version inside of myself, and it was time to make a change. Yeah, it wasn't even just that. See, here's the thing that often gets ignored is not only was I suffering from low testosterone, but I was also diagnosed with microscopic hematuria. I had failed a life insurance exam because I had non-visible blood in my urine, which is microscopic hematuria. Now, I knew enough that my training said, you likely have cancer. And so I went through a battery of different tests, including a kidney biopsy eventually, and it was diagnosed that I had IgA nephropathy, which is an autoimmune condition where my body produces too much IgA. It's a large cell that can clog up the tiny filters inside the kidney and result in renal failure. Here I am in my young 30s, and in tremendous debt from school and education and so forth, trying to start a family, and now I'm faced with the threat of losing my kidneys, not to mention low testosterone. I'm sharing this because the problem, in my opinion, when it comes to modern medicine, is that it looks everything from it looks at everything like from a mechanistic standpoint, looking at just individual parts versus looking at the entire system or the whole. And so doctors wanted to put me on, for example, ACE inhibitors and blood pressure medication that's been shown off-label to help men with IgA nephropathy. Now, you can also develop a chronic cough and other side effects as well. And then, of course, here's your TRT on top of all of that. I said, you know what, doctors, I appreciate what you're trying to do, but thanks, but no thanks. Let me go back to looking at what's going on. The insulin resistance, the chronic low-grade inflammation, the excess body fat that I was carrying. But you monitor me while I do this. Would that be a deal that you'd be willing to make with me? Because I wasn't doing this irresponsibly. And with their supervision, and I started to find ways through all of my research on how to get control of these conditions, the insulin resistance, the inflammation, the excessive aromatase activity. and started looking at my diet as a whole and my fitness and my body composition and my fat, and then looking at proper supplements for deficiency versus just randomly supplementing online. And to make a long story short, combining that now with changing my diet to a more carnivore, ketogenic, Mediterranean style diet, higher in saturated fat. It's not the enemy it's been made out to be. It's the building block. It's the precursor to all of your hormones. I got control of my inflammation. My insulin resistance went away. My inflammation disappeared. And as a result, so did over 30 pounds of body fat. And to this day, knock on wood, there's no more microscopic hematuria in my urine. My kidney markers will show that they should outlive me, which is the goal. And my testosterone has rebounded to well over 800 nanograms per deciliter, and I've never taken a shot, pill, medication of any kind. Well, I mean, when you're hit with a diagnosis where you could potentially lose your kidneys and end up on dialysis, it tends to wake you up. And this is what I mean by some of the biggest mistakes that men make is they wait for the wheels to come off the bus, because I quote unquote felt fine. I couldn't see that I had blood in my urine. It was non-visible. But here it was, my body was telling me, you're not in a good place. And if I had not been proactive in my labs, in my work, and staying on top of where I was, I may have lost my kidneys by now. And so it was that moment where I decided that it's time for me to take an offensive approach to my health, not only for myself, but then take these lessons. And it's the cornerstone of my practice today with all the men and the clients that I work with is I leave the downstream approach to modern medicine. But that, again, is a downstream reactive approach. We are focusing on lifestyle modification, doing the work, in other words, right? Because it's the work that makes you healthy, not just the end result. I mean, there's no comparison. You know, today at the age of 55, you know, I'm incredibly proud of what I've been able to achieve. You know, a 3-time Ironman triathlete, a Masters men's physique competitor. I've overcome emergency back surgery as well without a single pain medication, all through mindset, fitness, nutrition, diet, genetic testing, lab analysis, to be able to optimize my physiology, to perform and do things that I thought I would never be able to do. You know, at 55, you know, I maintain single-digit body fat year-round. I can play golf all weekend long without any aches and pains. I can race my stand-up jet ski with guys half my age, which is one of the most physically demanding sports you could ever participate in. It's like motocross on water. I can play pickleball all night long and not be in pain. I can keep up with guys half my age. I'm still gaining muscle in the gym. My brain is there. My focus is there. My energy is there. My libido is there. But what I'm really most proud of and what I really want to encourage most men to understand and to believe is that my medicine cabinet is empty. And that's the ultimate goal that I have for all of my clients, is pharmaceutically independent whenever possible. And shouldn't that be the goal of every practice? Well, the biggest myth out there is that decline is inevitable. That somehow expanding waistlines and tanking energy and declining libido and tanking testosterone are the new normal for men over 40. In fact, I've even heard medical professionals, well-known urologists, talk about how ubiquitous endocrine disrupting chemicals are. And as a result of that, you have no defense, sir, and you need TRT to be able to ever rebound your hormones not optimally again. Now, last I looked, I live in the same environment as you do. Yet somehow I'm able to rebound my testosterone without that dependence. So I think the biggest misconception is that decline is inevitable. And the phrase that I always tell guys is like, listen, it is true. Aging is inevitable. But how you age is a choice. And that choice is yours every day that you make. Right. Yeah, let's talk about aromatase too for a second. You know, aromatase isn't also the villain either in the sense, because we do need it. We do need that conversion of testosterone into estrogen to maintain a healthy testosterone to estrogen ratio. The problem is that men are turning it on with reckless abandon. It's like a wildfire that's gone out of control. And they're doing it through their lifestyle. They're doing it through sugar, processed food, alcohol intake, seed oils, endocrine disrupting chemicals, using artificial fragrances, deodorants, down to laundry detergent, the things that we breathe and take in on a daily basis. You know, you need to look at the home, you need to look at what's in your fridge, you need to look at what's in your pantry, and then you need to look at what your habits are. You know, and so what happens is it's the environment that needs to be addressed, because it's that modern standard American diet that men subscribe to that is creating and cultivating an environment that is fertile for excess aromatase activity that creates the very problem that men are trying to fight. Yeah, in essence, yeah, you want to start cutting those things out, right? Well, you want to eliminate all the sugars, you want to eliminate the processed food, you want to eliminate the seed oils, and you want to start replacing it with a whole food diet. Now, what do I mean by a whole food diet? You know, in today's modern world, and I smile a little as I say this because it's as if diets have become as polarizing as politics in some camps. And I'm not in any one camp. I'm in the common sense whole food camp. What did God and nature intend for us to eat? It's not the food that's the problem. It's what our industry does to the food that is the problem. And then one of the easiest things to do is start getting rid of anything that's in a bag or a box. Stay away from the inside of the aisles of the grocery store and shop around the perimeter. You know, we follow and I advocate and I show men how to use a carnivore, ketogenic, Mediterranean-style diet that's higher in saturated fat, how to strategically use carbohydrate cycling so they can get control of their metabolism and create metabolic flexibility so that they can start getting control of their glucose and their insulin and lower their triglycerides and start using free fatty acids for fuel so they can finally start shutting down the weight. See, we do before and after lab work with all of our clients. It's not just a reflection in the mirror or a number on the scale. Yes, that's what men ultimately want. But we also will do the blood work that shows that your inflammation is down, that your CRP is improved, that your homocysteine is improved, that your ferritin has gone down, that your insulin levels have gone down, your HbA1c has gone down, your triglycerides have gone down. These are all markers that are so paramount to helping men to optimize how they're feeling. They're such easy levers to pull when it's done strategically. And then we'll even go so far as combine it with genetic testing to see if there are actually genetic SNPs that can be interfering in the steroidogenesis pathway from cholesterol to testosterone. Or is it aromatizing? Are you suffering from the CYP19A1 enzyme where it's too overactive and it's converting too much testosterone into estrogen? And then there's strategic supplements that we can use to say, hey, let's calm that down so it's not so overactive. And so by doing that, and you start lowering those markers that I just talked about or improving the other ones, what happens is the hormones that are there, even if they're not 800 or 900, they can be in 500, but they start feeling better. Their energy is better. Their brain fog is gone. Their libido is back. All systems start coming back online. Yeah, you know, that's a good question. And, you know, and I can't fault the doctors. I have many friends that are medical professionals, and they all come at it from the right intention in the right place. I think it's a combination of things. One is the product of their teaching. Pharmacological agents are their number one tool. If you take their prescription pad away from them, what do they have to offer you? Not much, right? Not to mention, they typically only have 10 minutes with a patient. They don't have time to do the lifestyle education, modification, training, support. And many of the doctors themselves are not taught how to do this. You know, where their training went into pharmacology and to medicine and into surgery, for my education, we went into nutrition, therapeutics, lifestyle, fitness, training, and so forth. And so as a result of that, one, they lack the training, or two, they don't have the time, or both. And as a result of that, the easier fix is to say, well, here is your TRT. Let me make you feel better because that's what you want. So they end up not treating the patient. They end up treating the result that they want as opposed to addressing underlying root causes. I'm glad you asked that question because this is where the rubber meets the road. And I immediately think of Christopher. Now, Christopher is a gentleman that I started working with earlier this year. We're filming this in November. We met back in March. We had started our work together. Now, Christopher came to me as a last-ditch hope. He was north of 305 pounds. He has struggled with his weight his entire life. Okay? He lost weight, gained weight, lost weight, gained weight, and every time he gained a little bit more. Now, in December of last year, his testosterone was in the low 200s. Okay? Doctors didn't address his lifestyle. They immediately put him on TRT. His testosterone shot up to 1,200 nanograms per deciliter when he called me. He still felt like crap. I said, okay. And I said, where do you want to go with this? And he said, honestly, I just want to get control of my health again. I don't want to be dependent on these shots. It's inconvenient. I have to do it frequently. I got to stay on top of my labs. I got to monitor my hematocrit. And then, of course, testicles shrink as well when you're on this, right? And a whole litany of other potential problems as well. So I said, listen, well, let's take a root cause approach. I can't tell you what's going to happen, but what I can tell you is that it's going to give your body every opportunity to maximize its potential on its own. So what we did is then we did his lab analysis, we did his genetic testing. I put him on our custom peak performance protocol that is a complete lifestyle blueprint. Everything from the home to the office, to your diet, to your nutrition, to your pantry, what to eat, when to eat, how to eat it, how to prepare the food, what foods to buy, what amounts to eat. We put together a strategic fitness program for him using carbohydrate cycling and a combination of intermittent fasting and carnivore and ketogenic Mediterranean style diet. Once his lab results and genetic testing came in, we then put him on a custom supplement protocol to help lower SHBG, to lower triglycerides, to lower homocysteine levels, to lower CRP, to help bring omega-6 to omega-3 fatty acid ratio back into balance, an important inflammatory marker that's overlooked, right? Support cardiovascular health, blood flow, okay? And so we got to work, and now as of this recording, he is down over 100 pounds. His body fat has gone from 56% body fat to 25% body fat. He's now approaching 200 pounds. No more TRT. He no longer needs his blood pressure medication, to the amazement of his doctor, which I told him to supervise him while he was on this lifestyle program. No more statin medications either, to his amazement. He's on no medications. Now, his testosterone is back in the 500s without being on the TRT. And here's my forecast, my prognosis for him. That number will continue to improve because we're not done. It's reinvigorated what's possible for him, because now he's really believing I can get to 12% body fat. And in our practice, our standards are higher than the average American practice, right? The standard in America today is that's the new normal, right? Expanding waistlines, bulging medicine cabinets, tanking libido. That's all new normal, right? I'm sitting here going, no, that's not the new normal, even though it's common. Our standard for our practice is that you are meant to be lean, strong, and fit as men. Period, end of story. Fitness is paramount. Two biggest things that you can do to lower your risk of all-cause mortality: proper strength and VO2 max cardio. They can lower your risk of all-cause mortality by 3x and 5x respectively. No pill, no supplement, no shot, no medication, no TRT comes even close to reducing your risk for all-cause mortality as these two primary drivers in men's longevity. And those are free. Get out and start moving. Start exercising. Start training. Start treating it as a must-have, not a nice-to-have, right? And so by doing that and working with him, my expectation for Christopher is that his testosterone will continue to elevate. His energy is there. His libido is there. He's feeling best that he's ever felt in his entire life. And his wife is looking at him with a whole new set of eyes. Well, it only amplifies what's there. It's not just testosterone alone, right? So if you still have insulin resistance, you still have inflammation, right? You still have too much aromatase going on, you're amplifying those potential effects. You don't address the aromatase issue, all that exogenous testosterone that you're injecting into the body, guess what happens? It gets converted into estrogen. That's how men will then end up on an aromatase inhibitor. Not to mention, when you have too much estrogen that's floating around, it then can block the docking stations. Because you have to remember what testosterone is. Testosterone is a signaling molecule. It tells cells what to do. It has to be able to dock onto the cell, like a key into a lock. Now imagine that lock being gummed up with glue. You're not going to get the key in. You can have all the testosterone floating around, but if it can't get into the lock, it doesn't matter. But excess estrogen is not the only thing that blocks that receptors. Insulin resistance, inflammation, everything always comes back to that. And that's why we get such great results with our clients, because when you start dealing upstream versus downstream, you take the gum out of the lock so the key can exert its benefits. Yeah, so what happens when you have too much estrogen, especially when it's combined with insulin resistance, it interferes with ATP production in the brain. It creates neuroinflammation in the brain. It becomes unopposed. And as a result of that, the brain is not able to process thought and as quickly as it once used to because of that inflammation that's present. So until you start getting that estrogen number under control and get neuroinflammation under control, get insulin resistance out, and get proper ATP production occurring in the brain, that's where men will get a lot of that brain fog from. It's not the only reason. It's part of the equation. It's a complex issue. But that's one of the most overlooked reasons why men have that brain foggy feeling. Well, I'd like to think that, but yeah, it's, when you look at aging in and of itself, from a functional medicine standpoint, everything really comes down to energy production. What produces energy? Mitochondria. The mitochondria is the cellular source of energy throughout the body, through the brain, the heart, and muscles, and everywhere in between. When you have excessive estrogen or issues that are going on that lead to increased insulin resistance and increased inflammation and excess visceral body fat, that damages the mitochondria. It can glycate the cells. It can interfere with glucose being absorbed into the mitochondria so that it can go through the Krebs cycle and generate ATP. It can interfere with an amino acid called L-carnitine that shuttles free fatty acids into the mitochondria that help to generate ATP as well. Not to mention, when it comes to men's health and testosterone production, you have to understand the process. Right, the brain secretes FSH and LH that then signal the testes, the Sertoli cells, to produce sperm, for example, or the Leydig cells to produce testosterone. Well, where does that occur? That occurs in the mitochondria. Without healthy mitochondria, you cannot produce healthy hormones. So mitochondria are the fuel source, are the longevity organelle, in my opinion, to helping you to reverse age. It's how I have a biological age, even though I'm 55 chronologically, I'm in my low 40s. And I've done this through true age diagnostic testing and other testing to see where is my biological age. And it all comes through understanding how do you nurture and take care of your mitochondria and getting control of the elements we've been talking about, the alcohol, the processed food, the seed oils, the insulin resistance, the inflammation, the excess body fat, all of which are the perfect storm to damage your mitochondria and accelerate the aging process. So instead of reversing or slowing down the process, a lot of men have actually, unfortunately, unknowingly and unconsciously, have their foot on the throttle to accelerated aging. Yeah, it has. It's a pandemic. I call it the unspoken pandemic. Yeah, and again, it goes back to my point of a product of low standards and why fitness is such a big component of the work that we do. And grip strength is a true measure of someone's risk of lowering one's risk for all-cause mortality. It's not just about aesthetics or what magazine cover looks like. That's not what fitness means to me or anyone else in our program. We can certainly take anyone as far as they want to their fitness, but we focus on your biomarkers first. But the problem is in today's world and today's society, we're suffering from an epidemic of low standards, right? The dad bod is celebrated, seeing fit guys is few and far between. We're kind of the freaks. I'm looked at a little strangely because I eat healthier at lunch than maybe my counterparts do, right? People will make comments under their breath, right? Oh, I don't have time for it. It's for the vanity of it. I'm at a business to run. And then you combine that with men, how they're being rewarded. You know, they may have the home, they have the beautiful wife, they've got the cars, right? They buy their wife Gucci purses, right? And that's become now their badge of honor. But unfortunately, what men are doing is sacrificing their most precious asset for this outward success. And here's the thing. You know, I've been in practice for over 33 years, and I've worked with all types of men. And the number one regret that I have for my senior men is I really wish I had taken care of my health when I had the chance. Because none of that stuff, that material wealth, is going to matter when it's just going to your renal dialysis center or it's going to your long-term care facility, constant medications, unwanted doctor visits. To me, that's where the true wealth lies. And here's the thing. Men are leaving a lot of money on the table. And here's what I mean. You put someone in a room who can walk into a room and command massive respect and attention and admiration from their physique to their appearance, knowing that they've got their you-know-what together, right? They have the energy, they have the focus, they have the drive, they have the stamina, they have the confidence, they have the certainty. And they can go into that boardroom, they're going to make more money. They're going to produce more. They're going to be there for their kids. They're going to be there for their wife when it matters the most. They're not going to be afraid to take their shirt off at the pool or at night. I hear some men that won't even have sex with their wives anymore because they don't want to take their shirt off at night. They don't want their wife to see them. That, to me, is the ultimate sacrifice. And so what we need to do, in my opinion, from all medical professionals, is we, instead of lowering the bar on men's health, which is what we've done notoriously, we need to be raising the bar and demanding more. But here's the best part of all of it. You know those results I shared regarding Christopher and his story and his transformation? He achieved that while raising a young family, running his own pool company. He's a busy entrepreneur. He's out on the road all day cleaning pools, right? Training only 4 to 6 hours a week. That's it. Dialing in his nutrition, making choices that we all have for the ultimate ROI, and he got there in less than a year. Men are so much closer to their true peak performance than they actually realize if they just made a decision to raise their standards. You know, as I had mentioned before, you know, I'm one of the few medical providers out there in the back of the room that's saying that doesn't have to be the case. That is not the standard. That is not the normal. Look, I'm nothing different than any other man out there. I'm not some genetic gift. I'm not some genetic freak. I don't live my life in the gym. I make a few strategic adjustments and decisions that most men feel like they can't make. But that's just by choice. It's a mindset issue. And the passion really comes from this. We're the wealthiest nation in the world. We have the most educated doctors in the world. We take the most prescription medications in the world, yet we are one of the most unhealthiest nations on the planet. We're not suffering from a pharmaceutical deficiency. There is a time and place for those things. What we're suffering from is a standard that we hold for ourselves, a standard that we hold for ourselves in our practice. And for me, what brings me joy in the work that I do is seeing the lights come on and how quickly the lights can come on for the men that we work with through the lifestyle modifications. I talk to men every day. Their inflammation's gone, their pain is better, their libido is back, their fitness is back, they're getting stronger in the gym, and I'm not doing anything crazy. We're just challenging men to start doing the work. Stop looking for the shortcut. There is no shortcut to success without a price. And I challenge men, you don't have to pay that price, both in cost of medications and endless doctor visits or potential side effects. And so my goal for my practice and all my clients is to make them medically and pharmaceutically independent of all doctors, including myself. At the end of the day, isn't that what it should be? You know, doctor in Latin means to teach. And I challenge my clients every day. When was the last time your doctor actually taught you how to be healthy? Most doctors I see actually need someone like myself. And I'm not saying that flippantly or arrogantly, but their standards of themselves have been eroded so far, and they feel like that syringe or that orange pill bottle can come rescue them. When we have the data that shows that system's not working. Let's get the foundation right first. Let's raise our standards. Let's demand more. And you will get the ultimate ROI, which is complete independence in feeling and performing at your very best. What differentiates me from the average practitioner is that I give your body far more credit to be healthy and well on its own. Don't discount it. Don't play victim. The system has taught us you're a victim. Everything is a condition. Everything is a label. Everything has a magic pill, has a magic panacea, has a magic this and a magic that. And what I want people to walk away with at the end of the day, health is really not that complicated as it's been made out to be. And people are so much closer to expressing that natural health potential that lies within inside of them. And I tell my clients every single day this. And it's a paradigm shift because we've been taught this disease model of care, right? Symptom management. I mean, name one pharmacological drug that's cured anything. I'll wait. Right? They're all maintenance medications. You stop taking them, guess what? Problem is there again. And so what I'm saying is that have faith in your own body, but you have to do one thing. And this is probably the most difficult thing for Americans to face. You have to take personal responsibility for your health. You can't outsource it, can't scapegoat it. I can't train for you. I can't eat for you. I can't supplement for you. Those are things you have to do, right? And the more you try to avoid the work that's actually going to increase your odds of longevity, the more you're going to struggle. And the data and the statistics show that. And so my mission is to help to redefine a paradigm from a disease symptom model to a functional root cause model, to work upstream and downstream and stop playing defense with your health and start taking an offensive approach.